Hypothyroidism is a disease that has to do with the function of the gland. Our gland is the gland that produces a hormone called thyroid hormone. There's T3, T4, two hormones. It's right here in the base of our neck, right at the base of the neck. And it's called the energy gland. It produces the hormone that helps pretty much all the body control energy. Manages energy. It does a lot of other function, but basically that's what it does. It stimulates every organ in the body. Almost every cell in the body has receptors for the thyroid hormone. If a person has hypothyroidism, significant hypothyroidism, that means the hormone production is low. They're going to start feeling weaker than normal. Sometimes you feel cloudy mind, like they call it fog mind, fog. They can't concentrate well, lose concentration. More fatigue, and then it's harder to lose weight. Sometimes you start gaining some weight. If the problem is very severe, then you develop severe hypothyroidism, then the tissues start changing. Okay, and the more severe case is called mixed edema, where there's a lot of edema in the skin, especially around the eyes. The eyes start getting, full of fluid here, and sometimes the eyes, in some cases, they get very big. Depends on the disease, It just depends what the problem is in the thyroid, but the common ones are constipation. Some people get pain in the joints, and like I told, lack of energy, difficult losing weight. Risk factors, if you don't take enough iodine, sometimes that'll be one of the contributing factors. Now we live close to the ocean, and there's a lot of fish here, and fish has iodine, seafood has iodine, so we shouldn't have very much hypothyroidism, but there is a lot of it. So just the fact that you get older, you develop more hypothyroidism. Genetic factors, if your parents and family members might have had it in the past, you might get it easier. And it just happens. We don't know all the other causes, but it happens. Now, if left untreated, the problem is that since it's important for energy and it affects all your organs and your cells, when you don't get the stimulation, everything starts suffering. So that's when you start getting, the cells start degenerating a little bit easier, you lack energy, and you can have heart disease. The heart can start growing and go into heart failure. Your brain can start suffering a lot more because you don't have the gland, the stimulation. So you can get very sick. Just replace the hormone by hypothyroidism. Oh, the other thing is some people start gaining a lot of weight when it's very severe, and they can't lose the weight, and it's a doughy weight. It's a lot of fluid in their tissues as well. And the way you control it or fix it is by giving the hormone. It's a prescription medicine. We replace the hormone, and you do well. It's very simple. 1 pill a day, most of the time.